Hello, everyone. Today, my speech is on mental disorders. I am going to be explaining the differences of three of them. They are schizophrenia, bipolar, and depression disorder. Many of you listening today and many Americans believe that those three disorders are very similar or altogether the same, and this is not true. An estimated 22.1% of American adults ages 18 and over are diagnosed with a mental disorder in any given year. Some of you may know somebody or you yourself may suffer from a mental disorder, whether it be mild or severe. To be able to live a normal day-to-day life is very difficult. In order for me to be able to explain these disorders, I will be referring to some articles and websites. So we will all be able to understand these differences. The first illness I am going to be explaining to you is bipolar. Bipolar is a condition in which a person has periods of depressions and periods of extremely happy moods. And when they are happy, they are very happy, and when they are depressed, they are very depressed. Um, Even though bipolar is the most treatable, when they are not treated, patients often turn to suicide. And also, they live a very disabling life. Um, when they are treated, they are normally treated with mood stabilizers. And if given the right dosage, then they are able to live a very normal life. Next, I'm going to be explaining schizophrenia. Schizophrenia is a disorder affecting the brain. It is explained as a mental illness which the brain seems to be disconnected from itself, which causes indifferences, withdrawals, delusions, hallucinations, and disturbances in thinking and communicating with social functions. 2 million Americans suffer from schizophrenia. Um, as you can live a normal life with schizophrenia, with the right dose of meds, 3/4 of people who are being treated for this disorder often stop taking their medications because of their side effects, which some of their side effects include loosening muscle control, spasms, cramps in the head or neck. Other newer medications may be more effective in treating a broader range of symptoms of schizophrenia, and some fewer side effects than the traditional antipsychotic meds. The final disorder I'm going to be describing is depression disorder. Depression disorder is an emotional and physical disorder that is characterized by a general loss of interest and chronic feelings of sadness. It is important to note the symptoms are long-term and that sufferers cannot simply change their outlook on life. Depression is one of the most common treatable of all illnesses. 9.4 Americans suffer from depression. 1 in 4 women and 1 in 6 men will develop clinically significant depression over their lifetime. There are a combination of treatments with depression disorder. You can be treated with meds, or also you can be treated with just simply seeing a psychiatrist. In conclusion, I hope I accomplished what I hope to accomplish in my speech was to be able to tell you the differences in the disorders that I chose. Um, and also, it is important that we understand the differences and the signs in these disorders, because maybe you have a friend, a family member um, that might be suffering from one of these illnesses, and you can help or speak out before it is too late. Thank you for listening to my speech. I hope you enjoyed.